All right, cool. We'll give it 2 more minutes and then we'll begin the session. All right. I'll begin the session. Maybe um, I'll give some opening remarks for this session and why we're having it. But before I do, probably I wanted to invite Brian and Lynette, with whom we'll be having this conversation today, to kind of just unmute themselves and just introduce themselves. So I'll start with you, Lynette.
Yeah, thanks, Mark. Hi, and welcome everyone. My name is Lynette Kwamboka. I am the Senior Program Manager for the Data for Now initiative at the Global Partnership for Sustainable Development Data, where I am responsible for our capacity development work, and looking at working with governments in Africa and Latin America and the Caribbean, in strengthening data processes and data systems. Previously, I was the project manager for the Kenya Open Data Initiative at the Kenya ICT Authority. So that was for the government of Kenya, and I have also consulted for multiple governments on open data initiatives, including Mauritius, Ghana, Uganda, South Africa, in figuring out how governments can actually come in to do open data initiatives. Thanks.
Thanks, Lynette. And I ask you, Brian, to go next.
Thank you. Thank you, Mark. Hello, everyone, wherever you are. My name is Brian Mwende. I'm actually the founder of a startup called Think, the Tech Innovators Network. And what we do at Think is that we make an attempt to use communities to build resilient and sustainable technologies. So it's particularly around data, we're also trying to see whether we can create some platforms around data cooperatives and interoperability. Previously, I've done some work, particularly around our health sector here in Kenya. I was the lead enterprise architect for the Kenya Health Enterprise Architecture, where we laid the ground for the discussion on interoperability, both of systems and of data. I'm looking forward to the conversation today. Thank you.
Thanks, Brian. I will also invite you to look at your mic again, how you're coming in and out of the call at times, so that we can hear you properly. I'll also introduce myself. My name is Mark Kirura. I'm currently working with GIZ as an advisor on AI, but previously I worked with Development Gateway, and I've also worked with Open Institute on topics that are related to open data at the national and subnational level. I've also worked on topics to do with the Open Contracting Data Standard. And I think the reason why I'm moderating this session was back in 2018, I had the privilege of writing a chapter on the state of open data in health. It was a look back at the last 10 years. And back then, writing and talking about open data and not knowing that COVID would hit in 2020. So it was interesting to sit back and look at what I had written on the topic and kind of try to see whether it still resonated with what actually happened and how people were able to leverage open data as far as curbing the pandemic was concerned. I think one of the things back in 2018 that I wrote about that was apparent from the literature was the role of emerging tech and there being ubiquity in how devices and how Internet of Things can be leveraged to collect data. Of course, that is nothing new, according to the fourth industrial revolution. But then more importantly was the tensions between health open data and access to personal and private information. And I think we saw that a lot during the pandemic where, I could give the example of Kenya. Each and every week we had somebody from the Ministry of Health coming announcing the stats, sometimes naming and shaming some people who had been misbehaving or caught misbehaving, whereas we were trying to deal with a pandemic. So those were not anticipated so much in the chapter, but they articulated the issue of personal and sensitive data, and there, of course, being tensions between how it is accessed and state overreach or non-state overreach using our data, and the converse, like where do our rights begin and end. And I think we saw that a lot happening during the pandemic. But then more importantly, something that was of a positive outcome was how people were able to share information and research to accelerate, the understanding of how the pandemic was manifesting, especially through open science approaches. And so right now, I think we are here today to begin this discussion, looking at the health topic, knowing post the pandemic that it's a social and an economical issue, but then also when we are looking at health, we have to really bear in mind that is one of the most pieces of sensitive information that can be published out there. And we want to begin this discussion or this conversation by probably a question to one of the panelists before I turn to the audience and ask about this issue of collaboration. And I will turn to Brian now, asking about the issue of collaboration and the culture of data sharing. Predominantly in health, there's a lot of investments made in health data. Do we see the same level of effort being made in trying to promote collaboration and sharing of information? So I pass that to you, Brian, to start off or kick off the conversation, bearing in mind what we've seen over the last few years. Thanks.
Thank you for that, Mark. What I can say is, from the moment I got involved with the health sector, at least in Kenya, I think this was about 2016. There was already a lot of discussion about interoperability, about exchange, specifically to support the exchange of data. And I think that's a conversation that has really evolved. It's still continuing even to this day. I think there are quite some interesting evolutions in that space. But most importantly, I think the discussions are there. The discussions are always there. I think the real question is whether there's any action. A lot of the stakeholders are extremely aware that they're extremely aware of the benefits of non-duplication of the data and all the benefits of, even you could say, the what access to this data can actually do to the health sector itself. But many times, of course, the implementation is what becomes quite challenging. If I can just give you an example from, for instance, the agricultural sector. So the agricultural sector did an enterprise architecture possibly last year. Through the Agricultural Transformation Office, they did launch a kind of a data exchange this year. So it's very interesting for you to see, like, for instance, within the agricultural sector, the enterprise architecture was done, and within a year, they had actually driven that. Maybe it's because of the intention, or maybe it's because there's better understanding about the dividends of sharing data and collaborating. But ever since 2016, the health sector in Kenya has moved fairly slowly. There have been quite a number of donor-instigated, if you call it, programs, like, for instance, the Health Data Collaborative, just to check and map, in terms of what's actually going on within the space. But also beyond that, I think, for me, what I would say is, and this is a slightly into enterprise architecture discussion, is that we probably need to look at collaboration and exchange at 4 different levels. The first level, of course, is a level that is supported by regulation. So does regulation actually identify, and does regulation actually allow for the exchange of that data? I think we'll have quite a lot of discussion around that. I know of recent times, issues such as the Data Protection Act, and the entire ecosystem around personal data has really evolved within Kenya. But there's still that big question of interoperability. The second layer, you're probably looking at organizational collaboration. So there also has to be an intent of organizations to want to share, exchange data. This has allusions to creating more like a data value, having people understand that, what it takes, in terms of, a lot of people might look at it in terms of it is an actual data exchange. And a lot of people will look at data as something valuable. So I think part of that understanding has to occur at organizational level. But then beyond that, you're also finding that a number of organizational groups, like, for instance, the faith-based hospitals, are having that discussion amongst themselves. There are also groups of hospitals that are privately owned that have decided to actually manage and share data amongst their own ecosystem. Then, of course, beyond that, you're then looking at more into the technical layer of actually how this data is accessed and is interoperable. So, you're probably discussing here around things like semantic interoperability, in terms of, having an understanding of the types of data and the classifications of the data that exist. And then, of course, essentially at the end, you have technical interoperability. So, and technical openness. So, of course, when you're looking at health data, as you say, Mark, the spectrum is, you're moving from extremely private data, private identifiable data, in terms of a patient's EMR, all the way to just probably statistics that are useful for planning. So on the level of, for instance, technical interoperability of, say, private data to some extent, you're seeing this occurring in the private sector. So I know, like within our own setting here in Kenya, there's a bit of exchange of insurance data with several operators and some form of access with hospitals. But then finally, I mean, you're looking at also data that is now aggregated and anonymized that you can find at the Bureau of Statistics. So that's also accessible. But a lot of that, or some of that data, is behind paywalls. So the data is there, the data is available, so the digital transformation is taking place in the sector. But we still have a bit to go in terms of openness of that data and interoperability.
Thank you so much, Brian. And thank you for the elaborate response. I will come back to you with another question. You talked about regulation in your first point in terms of do the regulations allow data sharing? Okay, do the regulations allow data sharing? So I'm turning to you, Lynette, and I wanted to ask you about that within the context of if governance of health data and even health open data has changed over the last few years. And I want you to speak to it from multiple perspectives in terms of policy changes at the national or even at the regional level. Because with us, of course, we have an audience that is coming from Africa and beyond. So over to you, Lynette.
Great, thank you, Mark. I want to start this off with something that Brian mentioned, and that is the data values. At the Global Partnership, we have something called the Data Values Manifesto, which is a 5-point manifesto when it comes to making sure that data that is being produced and disseminated at the national government level, is equitable, is inclusive, but it's also, open to sharing. And this really comes in a way to regularize how we are thinking about the data. And the things that we think about is, supporting people to shape how they're represented in data, but also investing in public participation for accountability. Because when you think about open data, it's not just a matter of opening up data. There is also a big element of bringing in people into the process. So in that process, we have to democratize the skills for greater equality, because it doesn't help when you open up data, but people do not have the skills to question, to work with that data, to do anything with it. But in this, we also have to create cultures of transparency, data sharing, and use. In my experience, running open data projects for the government and the World Bank, the biggest issue really was in, creating the culture. It's one thing to create a platform, put it out, come up with the right, the best legislation that I'll talk about in a moment. But then there's no culture of sharing. There's no culture of, of use. There's no culture of transparency around this. So you find even the data that is being opened up, for example, if it's a Ministry of Health, any Ministry of Health, they might share how many hospitals they have, because maybe they have more hospitals than their, neighboring countries, but they're probably not sharing how many of these facilities have the right kinds of, infrastructure, personnel, what's the doctor to patients, nurse to patients, bed to patient ratios are. So, that all has to to come from that culture of transparency, data sharing, and data use for this kind of information to make sense. But then finally, the fifth manifesto in the Data Values project is funding open and responsive data systems so that all people share in the benefits of data. And to be able to do this, this is where also legislation now comes in. In Kenya, for example, we have the Access to Information Bill, law that governs how we can access data and information. And this law governs all kinds of data in the country, and especially from the national governments and some of the private sector entities that do work for the government. And it is in this law that, every Kenyan citizen is pretty much given a right to access information, as long as that information is not private, information about people. And health information is a really big piece when it comes to this. And Mark, you were mentioning this when you're talking about the, COVID numbers that were being shared, and how loosely people share other people's health status information on social media platforms. But we also have the, and interestingly, I was part of the team that, wrote the Access to Information bill and the Data Protection Bill. It used to be called, the Access to Information Bill used to be called the Freedom of Information. But then there was a big debate about what freedom of information actually means. So when the Access to Information Bill passed to law, the question was, do we just allow everyone to have access to everything, or do we come back and, regulate what people can have access to? And this is where the Data Protection Bill, which both of these are now law, came in. And in data protection, we are thinking about protecting people's very personal information. And personal information really depends on the context. In Kenya today, today, Thursday, 23rd, the KCSE examinations, this is education data, is being, released for the candidates who sat for KCSE. And all you need is someone's registration number, send it to a short code, and out of this short code, you get their results, sent to you. And anyone has access to this. Question is, should everyone have access to this, or is this personal and private information? But then when it comes to health, what if you could call the Nairobi Hospital or the Aga Khan and say, this is the patient number, I want the results from the labs? Is the privacy of these two pieces of information the same? How much of health information should be open, and how much of private information should be be considered to be public information? There's always an argument that is made when it comes to open data, especially in health, around public figures. Do we have a right to know that the president, for example, has malaria? Should everyone know that I, as a private citizen, have malaria? And should everyone know that the president has malaria? So those are some of the things that we start thinking about when we're thinking about open data and the legislation that is there. Up until actually November, the project ends in November, but we have been supporting from the Global Partnership, the Ministry of Health and other key stakeholders in coming up with the telemedicine standards and guidelines, that are backed by the now, legislated or in the now law on digital health. The idea here is that now we are moving to a point where everyone has access to a mobile phone. The fiber optic network in the country is very good. So that means when we're thinking about, doctor to patient ratios, in reducing the barriers to, accessing healthcare, we need to start thinking about access to telemedicine. And in this policy, one of the things that was very critical is, how is a patient's data treated? Because it's being channeled through some kind of a medium. So what channels qualify as telemedicine channels versus what channels do not qualify? Can I call a doctor on WhatsApp and talk to the doctor, or should there be a very standardized way of doing it through, for example, platforms like MyDawa, have a talk to a doctor, function, and how is this data then treated? Brian was talking about interoperability. Where should this data then rest? Can the Ministry of Health demand for access to this data even before citizens, start demanding for this kind of data? And what pieces of that data should they demand? Can they say, okay, we want to see if you had a video call, then, we should be able to see the video call. If I sent images to my doctor on, WhatsApp, versus if I went in and had images taken in a hospital, what's the situation around handling that information? So even when we talk about open health data, we now have to also have the conversation around the different channels through which this data is accessed and this data is shared, because we are now not necessarily moving away from the traditional ways that healthcare has been provided in the brick and mortar, where you have to go into a clinic, to a hospital to see a doctor, to now including digital health access. In the digital health law, now there's a group of people called community health promoters, and community health promoters get to go in and see people in their homes, in the villages, to provide at the very basic health health support before they can go to hospitals, and to pretty much find out how the community is doing. Where is that data? How is that data being collected? So I'm just here trying to go back to the fourth manifesto when it comes to data values, which is in creating cultures of transparency, data sharing, and data use. Before we even get to that point, there is the data collection point. We really need to map out a lot of that and understand how that is done before we get to this point. So there's lots of fantastic legislation when it comes to data that has been collected, has been stored, but then the way that the universe is moving, when you think about frontier technologies like AI, these laws need to be looked at, more frequently, to be able to include, new methods of data collection, new methods of data sharing, new methods of data use and data storage. And I'd like to throw in a little spanner here and think about, the way the laws are right now versus where the world is at right now when we're thinking about frontier technologies like AI and the use of bots. This was not envisioned in any of the laws that we have, except for the digital health, actually in the telemedicine standards and guidelines, where when we were sitting with the group that was drafting this, we were thinking about frontier technologies and how these are going to come in and affect health. So maybe we should also start looking at what frequency should we start, looking at the laws that exist to guide how data moves and, and works within the health space. I'm going to stop there. Over back to you, Mark.
Okay, thanks, Lynette. Even as you were talking, as you're talking about this in data collection, and we have these data points such as what we now call administrative data, like data that is housed in health management information systems as a source of primary data. We have other data that is collected through surveys, for example. From Kenya, we have the demographic health survey, and I know it's done in many countries. So these are some sources of health data that are in use. I think one of the things that I wanted to ask for the plenary right now, and it's something that has emerged a lot, especially from 2018, and also with emerging tech such as AI, is a colonial mindset to just getting data. Is there anyone who is working on this topic in the plenary who is free to open up their mic and just share a little bit about work that they are doing or they are planning to do with regards to like dealing with the power asymmetries when it comes to acquiring this data, and then if there are remedies in their own projects that are seeing it as a practical way to challenge the power dynamic, to government, to donors, to funders, because sometimes the benefit that is promised to the end user doesn't really translate back. So I open it if there are any views from the plenary. And of course, if any of the panelists also has a response on this, maybe do feel free to come in. And do you think you want to come in?
Sorry, Mark,
Lynette?
did you call on me?
Yes. Yes,
Oh.
now I can hear you. Yes.
No, quite sorry about that. So for me, I think what I'll actually mention is the underlying philosophy and belief that that we're working on at THINK, the Tech Innovators Network, and what we are actually exploring quite aggressively is the use of data cooperatives. So data cooperatives is a concept that I think has been researched and discussed quite extensively. It has its pros and cons, up to and including seminal writing by Professor Sandy Pentland out at MIT, and the data cooperatives have actually been used for many different things. But for us, it's really been about participation through collaboration. So that simply means that sometimes what happens is there's a lot of data that is collected, and the data is not accessible across the board, or there's some data that is collected by certain parties, which can be useful for other parties, but it is never really shared across. So one of the things we tried to do quite recently over at THINK is that we engaged with Atlas AI and Stanford University to see whether we could map out community health resilience within Kenya. And that amplified several things in terms of the challenges of the openness of the data itself, the availability of the data itself, and the interoperability of the data itself. So Stanford, which was offering some kind of interpretation knowledge in terms of the big data analytics, were very open and very happy to work on the project. Atlas AI, that had a whole series of satellite pictures with incredibly good resolution around, if you call it, the economic environment across the country had very open systems. And we then had the Kenya Bureau of Standards, which from where we were actually trying to get the facilities data, and getting the facilities data, which in essence should be publicly available open data, was extremely difficult. So the data is available. It's only within reports. It's, for instance, in PDF format. So there's a lot of data cleansing and data tagging that needed to take place to just make all of that data available. So the Kenya Bureau of Standards will tell you, hey, the data is open. It's here, but it's probably not in a format that is also extremely helpful. So the project was quite eye-opening, and I think for us, if we take the community perspective, and you actually, maybe we're going back to the data values and the data dividends discussion, but if you're also very much driven by like-minded individuals, we think formats of data cooperatives and intermediary collaboratives can actually work quite a lot without necessarily having to go, through the government. The government comes very late to the party, and of course there's the entire bureaucratic chain. So they'll tell you our data is open. You come to discover the data is actually not open. Or you find that the data has been sponsored by a given organization, so it's therefore not accessible. But a lot of these things kind of, we're only finding them out through practice. But as I said, the discussion is there. I think the challenges and implementation are what are taking time, but there's been some good progress as well.
All right. Thank you so much, Brian. Please, what I'm picking up from you is the need for, to challenge power. One of the things that you do is to have a community approach, and a community approach is where you have both the building of the tech and the engagement, right, in the data collection process, kind of a little bit federated, so that there is not one center that has a lot of power. I see Zedi has raised their hand. I don't know if you want to come in. Just unmute yourself.
Yes, please. Thank you so much.
Yes.
Yes, please. Thank you so much. I hope I'm audible.
Yes, we can hear you. You have a question or a comment or a response to the question that I had asked?
I just wanted to give a response to the question you'd asked previously. Perfect. On the power dynamics between.
Perfect.
Between
okay, please go for
person
it.
who's collecting data.
Please go for it. Zedi, you're coming in and out of the call.
So
are you still there?
The work that on data advocacy, and also in short, what will be? Yes. Okay. Sorry. Maybe let me just change my name if you give me a few.
All right.
Feel
Please
free to
do.
proceed,
Please do
with another person. Sort it out.
All right. We'll come back to you. Sorry, perils of working from home. In a call. Go. So I wanted to follow through with another question. As Zedi, you prepare to hear from you. And we are all here, and I'm assuming we are all champions of open data, and we think of it in a positive light. But then we specifically had the experience, especially from South Africa, when they announced the Just go, Amari, go. So the perils of sharing open data. So South Africa announced the Omicron variant, and it was actually punished through travel bans, like a real punishing, where they're embracing, the fair principles of open science and trying to be transparent in a pandemic. So I wanted to put that question out there again, probably to you, Lynette, and anyone else who wants to come in. When you talk about health data being open, maybe how open should be open, and not in the traditional sense of, like register and sensitive data and your conditions, but like, for a sense of the people in this discussion, like how open should we be thinking when you're trying to dig deeper into health open data?
Yeah, thanks, Mark. And situations like what happened during COVID in South Africa has me thinking that we shouldn't, that should not discourage anyone from opening up data, because when you think about generally open data, some people, in some cases, the general public is punished, when data is about finances opened and someone identifies a computer error. And then, the ministry responsible decides, okay, now we are not going to open up data, because when we open data, someone goes in and digs in and, finds something that then becomes a corruption issue. What we should be questioning is what can we do to change the way, society views people who open up data. And unfortunately, this goes back to what you're, discussing a moment ago around power dynamics. It is that there are societies that have more power, so they can punish you for having, for being in a certain situation. While when you look at, for example, the way the COVID, virus spread, it came in mostly from the global northern countries into the African countries. But the African countries cannot close their borders and say, no, we will not, allow anyone coming in from certain countries to come. But when South Africa says, hey, we have a new variant, which should actually be lauded, because then there should be more resources towards figuring out, what is going on. Then it's like, oh, now we do not want to see anyone from South Africa. But there were many variants going on everywhere else in the world. So when we're thinking about, what kind of data should be open, how should it be open, I am of the opinion that all data.
Is it just me, or
can you hear me? Hello?
Yes, we can hear you, Lynette. Mark had said something, but I didn't hear what he was saying, but we can hear you.
Oh, great. So then it's probably Mark's on Mark's side. Yeah, I'll also go off video just to save on bandwidth in case some are struggling. Thanks, Zeddy. Yeah, so for me, all data that complies with the regulations around access to information and data protection should be made public, should be opened up. The question becomes what happens after it is opened up. I'll give you a case in point. We started the Open Data Initiative in Kenya in 2011. And between 2011 and 2013, we really focused on opening up data. So going to different ministries, coming up with the open data platform, going to different ministries, asking them to open up data, sitting down to write the policies, the access to information, data protection came a little later, but then doing all, that groundwork, but we were very focused on the supply side. We did very little to look at the demand side. So we had all these, fantastic innovators who came up. I remember very distinctly one of the of the innovations that came out of it was this platform that used DHIS data in mapping out where the health facilities were in the country and what kinds of services, were being provided there. So you could go in and that if I go to, Mama Lucy Hospital, for example, that I can get an orthopedic surgeon there, but I cannot get a neurosurgeon. If I go to Mathari in Nyeri, I can get a neurosurgeon, I can get an orthopedic surgeon. So it was a matter of, as a user, who needs health services, if I log into this platform, if I have a broken leg, I don't have to go to, these are very, very hypothetical examples. I don't have to go to Mbagathi Hospital, for example, because they don't have the specialist, but I can go to Kenyatta Hospital because I can find help there. So instead of going to one hospital where I might stay there, wait for hours, I'm bleeding out, I can go directly to where I can get help. But then if you look at who was using this data, it was, very, very few people. And the argument was that people know where hospitals are, right? Or people know where schools are. So, the question of, giving out this information really does not arise. But then we realized that the problem was we were focusing so much on the supply and very little on the demand. And so between 2013 and 2016-17, around the time I left the ICT Authority, we focused very much on the demand. So, doing capacity development. Getting people, doing lots of seminars, getting people thinking and talking about this kind of data, showing them the kind of data that is there, doing some community outreach, in various counties. And one of the things, and I love this quote from then, and it still applies now, is one of the things we realized is there's also now this focus on demand for open data should be accessible on platforms, on digital platforms, on, technological platforms. But we tend to ignore other sources or other ways of data dissemination, like chats in hospitals, through community health workers, some of that information. So even going to a hospital and, how you go to a high school and there's a wall where they've painted, this is how much money we got from CDF, these are how many students we have, this is the principal and all those things. In hospitals, that kind of information, if you go to, I come from Nyamira district, if you go to, county now, if you go to Nyamira General Hospital, that information should be somewhere on a wall. So it's moving from, when you're talking about demand, it's also how do you disseminate the information so people know? Because health information is not just about health outcomes. I went to a doctor, or these are the number of people with malaria, these are the number of people with COVID. It's also, this is how much the government is dedicating in terms of resources towards health, towards hospitals, towards doctors. When you think about like the El Nino, financing, that is health information. Because if the governments are not dedicating any resources to, flooding, this is going to directly impact people's health. So maybe, very finally, we also need to start looking at what is defined as health data and how can we open it up to open up bigger conversations beyond saying these are the number of people who have a certain kind of, health outcome or disease. We should also be questioning all the way from this is how the government is dedicated towards making sure that you have a healthy nation. Yeah.
All right. Thanks, Lynette. I see Zedi, you're back. I want you to go back to the last question, which I had asked about, balancing power dynamics when it comes to publication, or looking at the spectrum of the data value chain and those who have power and ensuring that those are addressed. And then Lynette will come back to your output, to your comments. Before then, Slim can give a comment. I see here you had raised your hand, but I pass it over to you, Zedi.
Well, thank you so much, Mark. I hope it's now better.
Absolutely, absolutely. Please go.
Okay, so I was just mentioning that we are an organization in Western Kenya, like our name suggests, Icon Data and Learning. We focus on data literacy, and also we have components that deal with data advocacy and what we call collaborative networks. I think the initial speaker spoke a bit about it. This is where we have the cooperative networks. So just back to answer the question on power dynamics, I think once again we'll go. The conversation will always go back to what are the levels of data literacy within the community. And I realize that us working with majorly we work with nonprofits, and they collect data indiscriminately in the community. And what happens is that most of the community members do not understand their rights as data subjects, like what data are they obliged to give, what rights do they have as people who are giving out their data in terms of restriction, deletion, processing, and all else. But also beyond that, again, they do not understand how to harness the value of that data, or how to make sense of it at the end of the day, even when it's disseminated. So one of the approaches that we are taking to try and improve this literacy is that we are thinking of different ways on how to communicate the data in the community, and also how to disseminate it. And I liked when the previous speaker mentioned, just losing up, mentioned that if you go to the hospitals, we had traditionally what we call the charts. These are very interesting ways to visualize the data, and anyone who's any user who's trying to make sense out of the information or the data that is posted is able to quickly pick one, two, or three things. So in terms of open data, do you want to continue having data in quite technical documentations, and sometimes even in formats that are not readable or understandable to the person down in the community? And beyond that, I also just wanted to chime in on the conversation on open data. And one thing that we are picking is that in terms of where the data source is, we realize that nowadays most organizations have different data sources, and with it comes the challenge of the data quality, and also what is the centralized approach that is used to manage, store, or maybe access this data. And I'd be happy just to hear what the other speakers have to say about that. Thank you.
Thanks, Zeddy. I think also coming back to what you've just shared before I go to Lena's comment is like we also have people who put up, posters and murals. In Kenya, for example, we have the chalkboard. It's a form called MOH 516. It's used by the Ministry of Health, and it's used by community health workers to kind of aggregate and summarize some of the disease burden topics and issues which they find. And that's another example of what you're speaking to, and which really democratizes or improves like the engagement on the data at that level. I also see somebody else who has joined, who has worked on health management systems a lot in Kenya. Steve, welcome. Thanks for joining the call. I wanted to come back to what you shared, Lynette, and you had talked about the issue of transparency. It can cause harm. The open data can cause harm. But also, the good book tells us the truth can set you free. And in that particular instance is when there is an abundance of this information on this data, we can avoid just things being swept under the carpet, like bad things happening. So it's better to disclose than not to disclose. And I think that's the mindset, or the takeaway from that question on how open should open be. I think, I don't know if I can come to you, Slim. You had raised your hand briefly. If you had a comment or a question,
Yes, good afternoon. Yes,
Good
do you hear
afternoon.
me? Yes, in fact, I
Yes,
was
yes.
sharing in the chat a link first. Okay.
Okay.
In
Please go for it. Yeah.
Yes, my name is Slim Turki. I'm a researcher. I'm based in Luxembourg. I work both in open data and data ecosystem and the European and African context. And I would like to have your opinion on something that, since the new European data strategy that was published in 2020, in fact, there is a new statement that the value of data is not only in open data, but in the combination of publicly owned data, private data, plus personal data. And from that, the European Commission is funding more than 12 sector-specific common European data spaces. One of them is dedicated to health. The spirit of data spaces is not that we have a data lake where all the stakeholders throw their data. No, you set an infrastructure, but also governance rules, monetization rules, and mechanisms, things like that. So I would say a lot of money is invested in Europe to implement and consolidate these concepts. At the same time, in Africa, we are stuck with the open data debate. Personally, I'm an advocate for openness, but I'm wondering, are we limiting our discussions to data openness because our ecosystem are not ready to switch to this level of governance of data spaces, or what are we missing? It's almost a question of leapfrogging.
All right. Thank you for the question. I don't know if I want to share it with the panelists first. Brian or Lynette, you can just go first before I give a few reflections on it myself. Yes, Lynette.
Yeah, I can go. I can go with for that. Thanks, Slim. Actually, one of the things that we are currently working on is in that hybrid combination of open public data, privately held data, and citizen-generated data. And this is really important. One of the biggest problems that we find, for example, I like to say that most governments do the population census every 10 years, but I can assure you that every day, civil society organizations or private, mobile network operators can actually tell you what the population growth is or how many people are turning 18 because of, the movement of that. Within the privately held data sector, we are looking at not focusing on health, but we are currently doing 3 projects. One is mobile network operator data, and we are working with the government of Botswana, government of Mauritius, to look at how can privately held mobile network operator data help governments, for example, determine what tourism statistics are, what health outcomes are. And a big one out of this came out, from the COVID times, looking at how, Mark, you must have passed this to me. I have a little person in the room. Just a moment.
All right.
Sorry about that. Yeah, very, very, very quickly. Sorry. Working from home. So looking at, how can mobile network operator data, help us determine health outcomes from, during the COVID time, there was limited migration of people, but then if you're using, the telephone infrastructure, you can tell how people are migrating from one county to another. We're also looking at use of privately held data, scanner data. So when you're determining consumer price indices, determining the movement of the economy, how can supermarkets, or point of sale data tell you how the economy is actually doing? And now working with LinkedIn, we will be doing a training on privately held data, industry data. Right now, everyone is talking about AI and how AI is going to come and take everyone's jobs. But when you look at LinkedIn data, which is very granular at a very personal level, what is that data actually telling you about that movement? So yeah, I totally agree, Slim, that privately held data is very critical. And when we're talking about citizen-generated data, the Kenya National Bureau of Statistics has been doing a lot of work. We've supported part of that work, and next year we're doing a bigger project around access to citizen-generated data and bringing on citizens into the fold of, giving data to government as an alternative to administrative data. And data then, we start putting together the right kinds of processes, infrastructure to be able to receive that data and help governments work with that data.
Sorry, Lynette, you muted yourself.
Yeah, I said that's it from me, and over to Brian.
Okay, thanks. Brian?
Yeah, what I would say is I think this is it's a very good observation from you, Slim. And at least for me, I'll give you two responses in terms of approach. I agree with you, absolutely. Open data simply means that's data, it's almost trying to say this is data that's useful for everybody, which simply means it's potentially data that's not useful for anyone. So I always like the approach that you can potentially look at data around community interest groups. And what then happens is if a particular community of interest comes together, like insurers, then it is possible to actually define the data. So you don't just open everything. You need to open the data that is driven by specific interests and has very specific use cases. So that's one dimension. The second dimension that I think tries to capture what you're saying and also tries to look at what the EU is doing in terms of the data governance is that in at least what I'm seeing in Kenya is there's a bit of a move towards interoperability. So not just openness, but there has been publishing of interoperability standards. And then very recently, I think about a month ago, there was discussions about universal health coverage, and trying to really encourage public health facilities to start working around a given standard in terms of how the data they have is collected. What I've learned from talking to people about this is the standards are there, but the governance structure is not complete. So there are several other things that you've mentioned that are actually missing around this data interoperability discussion. So we have things like, there's no conformity assessment. So the standards are there, but no one is really checking whether they're being followed and things like that. So there are quite a number of good proposals. Implementation is still a challenge, but I think the regulatory interoperability layer is slowly evolving, and I think it will get there because we're seeing it get there in other sectors. Yeah.
Okay. I wanted to also offer a few reflections, but they are not, they align to the question that you said, and I don't think is that maybe Africa is not ready. It could be an issue, but I think part of it is the political aspect. Like data is still political, and for example, it's political in the sense that sometimes when it doesn't favor the political class or the elites, it is not favorable to use it. And if something is not in the favor of kind of publishing or allowing that to be done, and really it comes to transparency, then it might not take place. So what becomes the entry point? So that's the second question. Sometimes you're trying to introduce this at a national level. Maybe you should be trying to go to a department within a ministry, or at a ministry level, or at the subnational level, because there's less political resistance, because ultimately it's an issue of open government. And then I think the other thing is the creative distraction, for lack of a better word, that can be enabled by embracing open data. I think we are convinced about its potential and what it can do, but I think we have not fully tapped or harnessed it from a public sector perspective and a private sector perspective, especially as relates to the entire value chain, where Lynette talked both about the demand, the supply side, and also like the demand side, where like that, ending that loop has not been done quite well. I want to move on to my last round as we approach, the end of our discussion. And I put a question out to Brian. If he knows of any efforts or any initiatives out there to discuss or provide people, to show them both the benefits and the risks of health data or health open data.
Okay, I mean that's an interesting question. So definitely in the emerging technologies, particularly the IoT space, there's been a proliferation of wearables. I think that was a wave that came and it has maybe remained with fanatics, but there's definitely that wave of also people within the public. I think that wave of wearables has really helped people be more or less aware of their medical health data, but this is generally just let's just call it general health data. I think that was very quickly captured by the iPhones of this world, and they started making like super wearables that just had absolutely everything. But what I would say is this area, at least to me, also requires a little bit of not only civic education in terms of educating the public, but there's a level of education and a level of collaboration that is needed at policy level. I think what is happening is that, yes, the entire digital economy wave is coming. And it together with that, it has brought a little bit of, if you don't want to call it, a little bit of technology confusion. And I think quite a number of legal, well, quite a number of sectors have to deal with it. The digital economy is cross-cutting. So the question here is, okay, when you're dealing with health data, is that a matter that involves the ICT sector? So, or when you're looking at, for instance, the issue of personal identity. And now I think in Kenya we're revisiting the digital identity question. Is it a matter of security, or is it a matter of technology? So there's a little bit of confusion there, and it's actually really also coming into the policy pronouncements. So, for instance, there's a Kenya Digital Health Bill, that explicitly speaks about data localization. So what has happened is there's been quite a lot of people who organizations that have started building data centers locally, and they're trying to approach hospitals. But at the same time, because of big tech and specifically Amazon, there has been a push to remove data localization. So I think a lot of those things, simply because they're not looked at in particular context and from a very strategic point of view, the benefits and the dialogue and the discourse doesn't really have an output. And I think that is really where it needs to start. I think based on what Slim said, maybe just have a very clear understanding on data governance. And then in that dialogue, just have very, very clear discussions about the position of quite a number of these things. And then once that position has been made clear, then a lot of the benefits of opening up the data will be realized. But also, I mean, the realization is to notice that, you know, the government is late to this party. It's very, very late to this party, because as we say, private sector already has interoperability and some level of openness amongst itself. When there's a perception of value. But I think for maximum benefits in general, even to just the whole country, government has to really show up and have this discourse and this discussion with the citizens as well as with the private sector. And I think for me, that's really the parting shot. Is that government is a little late to the party, but they're a very integral player in terms of making things work. And I think the angle they should take is first have a very clear structure on data governance nationally. That's all.
Thanks. And I want to pick from your thoughts and ask you, Lynette, about inclusivity and representation, right? As far as health data is concerned. Do you see some gaps there? Like, are there pockets of people who are left behind? Are there potential biases that occur in the data? And you have some remedies on how we can try to help? I know there's a question also that has been asked by Meron on anonymization, but I come to you on that question, and then if there's anyone who has some responses or some thoughts on Meron's question in the chat, also please post or share. Over to you, Lynette.
Yeah, thanks, Mark. When it comes to inclusivity, bias, and exclusion of some communities, I'll still go back to what Brian has just mentioned. When we think about wearables, for example, wearables have put, health practitioners in a place where you have a lot of data. It's pretty much citizen-generated data and shared. And of course, companies like Apple, Samsung, and the other companies that create wearables have access to this information and can be used as they wish. And hopefully, ministries of health have this. But then think about the general population that has access to wearables versus that doesn't have, wearables. So there are some, legislations, there are some pronouncements that are made at the national government level that are, relying on information coming from a very small subset of citizens. But there are people out in the villages who do not have, access to this, and they might be excluded for that reason. We have seen in a few cases now, just like the price, just as the prices of chips and technology reduces, given the curve, the price of things like blood pressure machines has reduced. The price of owning some of these devices at home has now reduced, and we have many people who have access to this information. And going back to these devices, and going back to Slim's comment on citizen-generated data, they're really, to be more inclusive, we should also have platforms where citizens can self-report this kind of information. For example, we might have relatives who have diabetes, and they're required to measure their sugar levels every single day. A lot of the devices that we have are not connected, but then there's thousands and tens of thousands of people who every single day have to measure their blood sugar levels, who have to measure, and they only go to see a doctor when there's something off, but then getting that trend is really not there. The little person who walked in here a few moments ago is 3.5 years, and when she was born, I went on an exercise where I measured everything about myself and everything about her for a full year, every single day. So, looking at number of diapers that I changed, number of soiled diapers, number of wet diapers, my weight, how many times she fed, how many times she woke up at night, how many times I woke up at night. And when I actually wrote a blog about this, and when you look at that data, it's very interesting. What if we had 1,000 mothers in Kenya who, collected this information, and this data was used, to come up with a super diaper, for example, that can, go through the night, or came up with a super mattress that allowed you to sleep better. Because those are the outcomes that you expect when you're thinking about health. In many cases, we think about, medicine, but then there's also other things that can contribute to comfort. As Brian was speaking, one of the things that I was thinking about is things like health information. Part of health information is, for example, gym information. Most mornings when I go to the gym, there's tens of people there, and most people are wearing, their wearables. And where does this information end up when we're talking about, a healthy nation? Where does the government of Kenya have access to this information in terms of the number of people? So bias comes in when we rely on data that is accessible to us, and data and really forget about populations whose data we only have access to when something goes wrong. So we need to figure out, how can we encourage citizen-generated data? How can we encourage self-reporting for this data to be more inclusive, for this data to, be available in places where any, policy or investments that are made to the general public are more inclusive in that way. So I think, I don't know if we need to give everyone a wearable as an easier way of doing it, or if we need to, find platforms and policies that allow people to share this information. But it also then goes back to, anonymization of this information. And how do we ensure that people's data is not, collected and shared so liberally? Or how do we ensure, super security of this, kind of information? Because we know, especially with health information, there can be discrimination beyond even bias. There can be discrimination that comes out of this, because people might decide, oh, okay, this person has X, so we are going to be discriminate against that. Think about cultural practices and cultural issues. We cannot run away from that. When we've seen in the news in the recent past, and this happens every time we have long holidays, that now there are X number of girls who are, been sexually abused because they're minors, and you have a whole class of girls who are now pregnant. How do we use this information to plan better for next year? And planning better does not necessarily mean that we keep kids in school for longer, but can we find other ways of, having kids in safe spaces? Can we find, ways of making sure that kids are protected? And so we have to really look at this information, and this is the kind of information that we ignore, because this information only comes to light when someone takes a picture and shares on social media, and then the media picks it up. But then there's no self-reporting that is happening. There's no chief coming, forward to say, I'm worried about my village and the girls in my village. So those are some of the things that we really need to think about when it comes to, bias. And finally, I would like to encourage us to really open up our thinking about, what health data is, and be more inclusive about other sources of health data that are not just, hospital, doctor-patient type data, because health data is really, really, really big. Thanks.
Thanks, Lynette. Thanks for the response. I see we have almost 5 minutes to go. I don't know if there is a question from the plenary, if somebody has something to ask. And there's also a question that has been posted by Meron. I don't have a direct answer to that, apart from what I shared, which is an answer, I'm afraid. Maybe I'll ask Margaret. You've raised your hand. You can come in. But if anyone has a response for Meron, please cue it up. Over to you, Margaret.
Very much, Mike. Thank you very much for allowing me. I've been getting a lot. This discussion has opened my mind to a lot of things that I have not looked at. But I also see a gap in the availability of, especially in Africa, effect of vaccines on people. We seem to just get the vaccines, throw it out to the citizens. Nobody follows up to see what happened to the people who took the vaccines. So, for instance, I was following, in Ghana, for instance, we have the public health service. They go to schools and they have some vaccination for children. And I noticed I have a niece who got a stroke, 8-year-old who got a stroke after 2 weeks after the vaccine. And along the line, I look at her age groups. A lot of children, different children from different towns, have stroke. So I was thinking, could it be a vaccination effect? Who is monitoring these things to give us an outcome of what they put out to these children? And yesterday, something came out of my mind. I learned in the news for a school that some experiment is going on. They are giving the girls pills every day. So they give to the teachers, and every day they make sure the teachers are giving the pills to the children. So it came to my mind, who is collecting these data, and what are the effects of these pills after, let's say, 20 years from now? Who is following these girls to know the effect of the pills they gave to these children, so that we will know that it's not everything somebody brings to us for free that we collect. We have become guinea pigs for experiments for a lot of health issues. When they want to bring out anything, they only give money to governments, and the governments take it, and then they start administering these medications. They collect their data for those few months or years that they want to do the experiment, and then off they go. How about who is following for the long-time effect on these children? So I see a gap in that health data that we don't know yet. Thank you.
Thank you very much. Thank you for that observation. I think I will begin to wrap up the conversation. Chris, I see your question, and I'm just posting a response to it. I think we want to wrap up this discussion is for us to consider and think about open data as a digital public good that has an entry point. That's one. Number two, data has a political element, and sometimes it challenges the status quo in some sense. Linet has walked that journey from the very start here in Kenya, for example, to a place where people would see open data as a thing that would actually be done or embraced by the government and by private sector. So unfortunately, there's this thinking of open data like in health, and open data generally as a project or a program. But if we have longevity to it and think of it as a digital public good, I think there's opportunities to think about the governance and not just the technology of a longer term. And then also, I think we will not just think about the supply side of the data, how do we get it, but also like the demand, how do we open it up to other intermediaries who can use it, whether it's for research, others who can use it, whether it's for generic analytics and insights, or to build applications that interface with citizens, to also promote, citizen-generated data and so forth. So I want to bring the discussion to a close, and thank you so much for taking time to listen to this. I think there's a lot that is evolving in this space, in the health data. And of course, we haven't talked about AI in this discussion today, another emerging tech and how they will impact what the future looks like. But we look forward to think about what the next 2 or 3 years will look like in terms of open data in health. I don't think open data is dead. I want to give it back to D4D, to somebody to moderate and bring everything to a close. Thank you so much. I see you, Moshiri. I recognize you, Moshiri. I recognize you.
Right. I feel recognized, I feel appreciated and affirmed. Thank you so much. But what a fantastic conversation. The whole spectrum from policy to conversations on inclusivity, and some very strong threads on accountability. And I think that just shows you how broad the issue, especially around health open data, is. The interoperability issues that were raised in the conversation there just took me back to a point in time when we were talking about the portability of health data, and now what kind of structures, infrastructure, human resource, etc., is needed to make it possible for you to walk into a health facility in one place with data from a health provider in a different place. And many of our countries in the global south, that's been growing and taking shape, and it's interesting to see. And as we work towards catching up on the health data standards that we see in the West. And now what happens? The next question, what happens when that interoperability now steps into the open space? So it was really nice, just hearing some of this, and I'm sure we will be inspired. I'm looking forward to the next edition of the State of Open Data, where Mark and the team unpack the effect of AI and other emerging tech, because that's the trajectory we are going. And I'm sure most of us can see what's peeping over the horizon. So thank you so much for joining us today from wherever you are. This series of roundtables, of course, have been really useful for us in terms of sharing with everyone what has changed since the first State of Open Data report was published, within the various thematic areas. This is the fourth in a series of roundtables that we're having on these updates to the State of Open Data report. And we have one more tomorrow on geospatial data. So do join us. Let's join another amazing panel talking about geospatial data in the context of open data. I'm sure you shall find that as